Good morning. Invoking the blessings of the Almighty, our gratitude to Sadguru Sri Madhusudan Sai, the vision behind the conference. Dignitaries seated on the dais, respected elders, doctors, delegates, and members of the medical fraternity seated here, and all those joining us live on the webinar, students and staff of the university, a very, very good morning and welcome to the inaugural session of the two-day International Conference on the Future of Medical Education 2021, presented by Sri Sathya Sai University for Human Excellence. At the outset, we would like to welcome all the dignitaries on the dais. Padma Shri awardee Dr. B.N. Gangadhar, President, Medical Assessment and Rating Board, National Medical Commission, India. Dr. G. Geeta Krishnan, Clinical Scientist and Officer, Traditional Complementary and Integrative Medicine Unit, World Health Organization, Geneva, Switzerland. Dr. S. Sachidanand, former Vice Chancellor, Rajiv Gandhi University of Health Sciences. Dr. K.S. Anand, Professor of Pediatrics and Anesthesiology, Stanford University School of Medicine, USA. A special welcome to Dr. M.R. Raj Gopal, Founder, Chairman of Pallium India, Kerala, who's joining us virtually. Mr. C. Srinivas, Chairman, Sri Sathya Sai Health and Education Trust. Mr. B. N. Narasimhamurthy, Chancellor, Sri Sathya Sai University for Human Excellence. Mr. Srikanthamurthy, Vice Chancellor, Sri Sathya Sai University for Human Excellence. Revered Sadguru Sri Madhusudan Sai, Social and Spiritual Leader and Founder, Sri Sathya Sai University for Human Excellence. We would now like to invite all the dignitaries on dais to light the lamp and unveil the logo for the International Conference on the Future of Medical Education 2021. Vaidyo Narayano Hari proclaims the Indian culture, meaning doctor is God. The World Health Organization emphasizes the criticality of universal health coverage, and it is defined as All people have healthcare services as they need, when and where they need, without financial hardship. This is only possible because medical education and healthcare providers are really the foundations towards achieving this dream. In India, universal health coverage is significantly impacted by the acute shortage of doctors and the eventual skewed urban distribution. While quality and proficiency of medical education are challenges, the bigger issue is the inaccessibility for rural and socially disadvantaged populations. The prolonged COVID-19 pandemic has revealed a critical need for reforms in the current medical education system, with the primary objective of making healthcare services more affordable, more accessible. And without forgetting, medical education has love and compassion as its foundation tenets. The Conference of the Future Education of Medical Education brings together leading experts in medical education from different countries to share ideas and develop programs that can facilitate this much needed national and international reform policy in terms of the format, scope, funding, evaluation, and access to medical education and postgraduate training. This conference is being conducted with the expert involvement of Stanford University School of Medicine. Thank you, Dr. K.S. Anand, for your expert advice in putting this conference together. We now invite Mr. C. Srinivas to deliver his welcome address. Mr. Srinivas is the chairman of the Sri Sathya Sai Health and Education Trust, a healthcare visionary who has led national institutions aimed at ensuring accessibility and affordable care to the doorstep. The Sri Sathya Sai Sanjeevani Centers for Child Heart Care address the national goals of mother and child health by providing all services free of cost and ensuring the entire spectrum of care is provided, which includes prevention, cure, research, and training. Mr. Srinivas.
Most revered, beloved and dearest Bhagwan, Sadguru Madhusudan Sai, august dignitaries, legends in their own right, men of wisdom and achievement on the dais, so many more present here and participating in what should be the most important address of our times: healthcare, healthcare delivery, healthcare education of not just one country, but the entire globe. This event put together will question, will reflect, will deliberate, brainstorm, and give an answer to what is this burning issue of our times. We are all aware that some questions in life have to be asked at some points in time. The question in front of us today is, from one side, for every young man and woman who intends to become a doctor, a healthcare practitioner, or a caregiver. The question that confronts him and begs to be asked of all of us is, why does a young man or woman want to become a doctor or a caregiver? What is the process and means and methodology of making a good doctor, healthcare giver, and servitor of humanity. And most importantly, what do we do with the life ahead of us after we become a doctor, a healthcare giver, or a servitor of humanity? We are all aware, and with the august presence of a representation from the WHO, that healthcare education in particular addresses the curation of illness, the prevention of disease, and most importantly and relevant to the times that we are living in, the promotion of wellness and well-being. The need of the hour has only been accentuated by the last couple of years that what humanity has gone through. The two practicing legs for a doctor in the pursuit of his mission seem to point at what Sadguru Madhusudan Sai so beautifully articulated: ability, which is what medical education pursues and ensures in every young man and woman. And with ability, the most needed quality of our times, nobility. Nobility with ability will form the foundation of medical education and the making of a doctor or a healthcare giver or a human being that should be living as a gift of God to discharge his mission of life. This being what it is, this conference will focus on these aspects most needed, wherein with leaders who've lived and exemplified these noble values in the lives that they have led, and they intend to make many more as role models of their own, we wish to make this event, most importantly, provide an answer in our times. May I submit to this august event in the very beginning that the need of the hour is, like we have an example in India, we have the Indian Administrative Service, we have the Indian Revenue Service, we have the Indian Foreign Service. The time has now come for amongst the most populated countries of our times to have a national medical service, a service which dedicates itself to the well-being, to the prevention of illness, the promotion of wellness of its citizens. If this can be replicated as a model in every country, we should not be like the people who address a problem when it surfaces. We need to prevent it. We need to have answers before problems happen. And the need of the hour is for a national medical service corps. The foundations being men expertised in different abilities of medicine and with the noble qualities of what it should take to deliver this for those in need and those inadequately served. May we all sit together as one. The time has come, and in an umbrella which states, love all, serve all. What a greater mantra that humanity can learn and live by than this principle. The heart of medicine, the heart of healthcare teaches us that love abides in every single human being. The heart does not distinguish between Hindu or Muslim, black or white. It just answers to the beat of love. May this conclave be a game changer. May a path breaker emerge out of this event wherein we think, live, learn, and work as one. May the hallowed ground of Satyasai Grama under the auspices of this brilliant university made to bring about men and women of caliber and servitude for the country produce these much needed answers. God bless and Godspeed on this mission. May I welcome the revered Dr. M.R. Rajagopal now to give us his keynote address. Some people need no introduction. They are so well known because their words have not spoken, but their actions are. Dr. M.R. Rajagopal.
We would now have the keynote address, Padma Shri awardee Dr. M.R. Raj Gopal. Dr. Raj Gopal is an Indian palliative care physician and founder chairman of Pallium India, a palliative care NGO in Kerala, India. He also directs the WHO Collaborating Center for Policy and Training on access to pain relief at the Trivandrum Institute of Palliative Sciences and serves as a member of the Elizabeth Kubler-Ross Foundation Board. Dr. Raj Gopal is often referred to as the father of palliative care in India.
Ladies and gentlemen, a great opportunity to talk to you all, and particularly on such a worthwhile subject. We are on the brink of a breakthrough, I genuinely feel, in the scene of relief of suffering from health issues in this country, because now palliative care has been officially included in the medical curriculum. National health policy has included palliative care through 150,000 family wellness centers, and this is actually the perfect time to discuss this subject. So thank you, organizers, for giving me this opportunity. I want to tell you about the relevance of inclusion of palliative care in medical education, the current status, and the way forward. I would like to share my screen and show you this article. I'm just giving one extract from it. Miss Sindhu wrote in the Hindu of 2016 this article, for which I have given the link in the bottom. She writes, "My 84-year-old father, my best friend, was enduring raw, intrusive medical procedures against his own wish. All skin and bones, he looked defenseless and at the mercy of doctors, his arms tied up, vulnerable and agonized. I, with some difficulty, found Sindhu's contact information, wrote to her, and then we talked. Then she came to Trivandrum, actually came to us to see the palliative care work. And she explained this horror story, how she wanted more than anything else to save him from that hell. Found out about palliative care one night and told his father, "Dad, in the morning I am coming and saving you from here." But at around 5 o'clock, he had died. A cruel kind of death. This is the context in which I am telling you about this quote from Dr. Sankhamitra, a Bengali doctor who is a UK citizen now working in Australia and doing noble work in India, spending all his salary, living on his wife's earning, and his salary comes to relief of suffering in northeast of India. He says The poor die in misery of neglect in India, like this woman. But at least they'll get a drop of water down their throats. They'll be in their own bed. The middle class die in misery of ignorance, and the rich die in misery on ventilators like Sindhu's father. No one gets a pain free and dignified death. Sangha talks about death, but till one is dead, one is living. The truth is, from the moment one gets a serious illness, the disease gets attention, it becomes the focus, and the person and the suffering gets forgotten. The state of the art end of life care in India, I fear, for more than 96% of people, among among maybe among something like 10 million, 1 crore in serious health related suffering, for 96, it violates 96%, it violates every principle of medical ethics. You no longer have any right over yourself, your autonomy is stolen from you. The medical system is no longer dying to do good for you, it's trying to prolong your life at enormous cost. It's actually causing harm by inflicting suffering. And it violates the principle of distributive justice, because what's being done, wasting precious healthcare resources to inflict suffering on the dying person, does not fit into any sense of justice, and it violates human dignity. In this context, I truly believe that medical students and people with lived experiences could well be the agents of change. We professionals are like full glasses of water. It's full. It's difficult for us to take anymore. They are empty there. And the people with lived experiences, like Sindhu for her dad, they being given a forum to talk about this more, so that the healthcare system listens a little more. That is key to it. And whenever I talk to medical students, I find them very open to learning. They have not become sarcastic yet. They are no longer medical machines. They still feel. I truly believe that our focus, more than anything else, certainly it is important to uh, teach doctors who are already practicing. It is important to teach other professionals, but reaching the common people and reaching the medical students can be the most valuable. When I get groups of medical students together, I generally ask them to share their own experiences as a patient or as a family member in a hospital. Uh, you would be surprised at the stories that come out. Horror stories come out. 1 in 10 stories may be a good story, but 9 out of 10 memorable experiences are horror stories. That's all very negative things that I have been talking so far. But what is positive? Now, most elements of palliative care are in the medical curriculum. Medical students starting to do this from 2019, who joined medical colleges in 2019, are supposed to learn this. Officially, pain management is in the curriculum. So is for the first time end of life care. And a new module has come in, 8COM, that is attitude, ethics, and communication. This is there in the curriculum. Now, Unfortunately, around the same time, the pandemic also came in, uh, curtailed progress, but it's there officially. What we need to convey to the medical students is to start with the duty of care of a doctor, as defined by the Indian Council of Medical Research, because India does not have a law covering this. The duty of care of a healthcare professional is to mitigate suffering. It is to cure sometimes, relieve often, and to comfort always. There exists no exception to this rule. And therefore, we have to get them trained in symptom control. Not only that, once this man's agonizing pain has gone or mostly relieved, when his mind space is not full with pain, he will have numerous concerns. He'll worry about his unfinished business. You will then have to restore a life with dignity and autonomy during those times, enabling him to attend to the unfinished business, assisting that person to attend to the unfinished business, but also restoring connections. Where should he be? However humble that home is, that is his home. The tree that he sees out of the window is part of his life, part of his spiritual makeup. If his deepest connection is with God, we have to make that sure that he does not get disconnected from that. If at all possible, I would keep that person in his own home where he feels he belongs. In our organization, we have 8 teams going out on home visits every day. We have only 14 inpatient beds. Thousands of our patients live at home, get cared for there, or those who can travel come to an outpatient clinic. But we keep them connected where they belong. And we have to give them a meaning and purpose in life. There is no life if there is no hope. That hope has to be realistic. If I tell him, you are going to be cured, he will not trust me, he will not believe me. But hope of something achievable, which may be just a hug with a brother with whom he has broken up 6 years back. Every minute has to be made meaningful. But, ladies and gentlemen, how do we teach this to the medical students when they do not see this being practiced? This is as of May 2021. By now, there will be more. Those are the numbers. Less than 10% of those medical colleges have palliative care services. So they'll be taught things that they don't see. It'll have no relation to reality. It'll be forgotten once a final examination is over. So right now, over the next many years before palliative care becomes part of every tertiary institution, how do we compensate for the lack of practical exposure? Our strategy now, we would certainly hope to hear more from you, is partly about participatory learning. Students sharing stories, but it'll be a lot by storytelling by the faculty. And we'll have to enable the faculty to be able to do that. When I tell the person about my patient who kept on saying, what's the point? I might as well be dead. I wish it would all end. When I asked her what makes her the most hopeless, she said, the only thing that I really enjoyed doing was copying the Bhagavad Gita. In the space of technology, she was copying the Bhagavad Gita line by line. Somehow, that enabled her to study it further. That made life meaningful. The daughter went on saying, Mom, you don't have to be useful anymore. You brought us all up. It's now time to rest. You don't have to be useful. She was reinforcing her hopelessness. Instead, if only we could give her a device from which she could still uh, listen to Bhagavad Gita and maybe even dictate what she feels about it. Maybe that would have given a lot of difference. Such stories being given to the medical students in every aspect, they would be very important. And we need to provide them with demonstration videos and trigger videos which stimulate thought. This is what actually we are trying to do right at the moment. I'm glad you have given this opportunity to share this with you. Our creation of modules is almost complete. They'll be refined and ready by the end of December. So will be the training materials, including PowerPoint presentations, and 5 minute trigger videos will be ready. This will be ready by December, end of December. In January, it will go up on our website for free access to anyone. We have contacted all the medical colleges, and many have expressed interest. It's only a minority, I must admit. We will do virtual training the trainers programs for the faculty, and this is the best that we could think of. I hope you will all apply your minds to this. I am sure you will have marvelous ideas which will be educative for us, will help us to refine our program. But ladies and gentlemen, we have this very important task ahead of us. The Medical Council has done its job of inclusion in the curriculum. We have to make it work. Thank you once again. I'll wait to answer any questions and to listen to your precious comments. Thank you once again.
This was a recorded video presentation sent by Dr. Raj Gopal with his informative talk. Thank you, sir. And now he's joined us live, and he'd like to give his closing remarks. Dr. Raj Gopal.
Namaste once again. Thank you very much. I would like to remind all of you about a transformation in healthcare that has happened in our country. We have largely brought in the technology and scientific acumen. I hope I'm audible. Uh, Please indicate if there's a problem with the audio. Uh, what we have not done in this country is to bring the social workers from and the palliative care that is there in the West, so that less than 4% of the needy get any access to pain relief, even basic pain relief. 96% of people do not. Secondly, the cultural shift in the society has also happened. We were in culturally, I mean, Hinduism practiced Prayogavesha. Jainism practiced Sandara or Salekhana. That's the extreme. But the principle is not about death. It's about living until you die. Now, if you have an incurable illness, you are rejected. That's unfair. Someday it's going to be my turn. I would like to remind you all, I am living till the moment of death. And I believe the medical system has a responsibility to make my life worth living, even at that time. And that's the whole point. The tamed death that was part of our culture, accepted as the inevitable, now has become forbidden death. The dying process is stretched out for weeks and sometimes months on extracorporeal membrane oxygenators. And that, I believe, is a person can be a person's choice. In which case, I should have the choice. of living in my home in the last few days. Only a uh, week and a half back, Dr. Christopher Booth from Queen's University wrote about the value of time for somebody living with advanced cancer. An hour of his time or her time is not like my time now. That is a big fraction of the remaining time that should not be spent all in hospital corridors. They should be made comfortable. They should get love and care and should live the life that they choose at that point of time. Please help us in our mission of relieving suffering in this country from healthcare issues. Thank you very much.
Thank you, sir. The WHO estimates that around 100 million people around the globe fall into the poverty trap due to inaccessible and unaffordable healthcare. This conference is a forum for great minds to come together to deliberate and address this gap. We now have a short video highlighting the gap and possible ways of addressing it.
It is said that health is one's greatest wealth. And yet, in India, rural healthcare remains one of the biggest challenges facing the country. With more than 60% of the population living in rural areas, healthcare for them is a distant dream, hampered by unaffordability and inaccessibility. This difficulty is perpetuated by commercialization of not only medical care, but medical education itself. The Economic Survey 2020-2021 reveals the dire situation of medical care required. It shows that despite efforts to increase public institutions, around 74% of outpatient care and 65% of hospitalization care remains provided through the private sector in urban India. It is on this path of purpose that the Sri Sathya Sai Sanjeevani Child Heart Care facilities in the Indian states of Chhattisgarh, Haryana and Maharashtra were established in the last 10 years, and the Sri Sathya Sai Sarala Memorial Hospital at Muddinahalli here in Karnataka was dedicated to the nation. Services across all these healthcare facilities are offered absolutely free of cost. The prolonged pandemic battle in March 2020 brought all the stakeholders of the country together, government, private sector, social sector and communities to build efficient and accessible healthcare solutions. The COVID-19 pandemic has highlighted the need to collectively nurture a more holistic healthcare system with healthcare workers at its core. Infrastructure for serving the masses can be built in a short period of time, but trained, qualified, and empathetic medical professionals willing to serve in rural India continue to pose difficulties. Though medical schools in India produce the largest number of doctors than anywhere else in the world, the availability of these specialists is skewed towards urban private centers owing to better facilities, opportunities, and lifestyles. On the other hand, cost of medical education is often seen as an underlying factor affecting the care provision decision of medical teams. In order to address the challenge of access to medical teams in rural India, there is an acute need for the system to redefine existing medical education models in line with the National Health Policy and the National Medical Commission to ensure accessible and affordable quality medical care in India with a primary focus on rural geographies. Thus, as a first step in this endeavor, the Sri Sathya Sai University for Human Excellence is honored to host the International Conference on the Future of Medical Education 2021. With expert involvement of the Stanford University School of Medicine, this two-day conference will witness a convergence of expert professionals from various parts of the world to deliberate on the topics of undergraduate and postgraduate medical education, to develop medical education programs that incorporate training in social, psychological, emotional, cultural, and spiritual aspects of medical care, to explore the use of novel technology to expand the accessibility and affordability of medical care for underserved and marginalized populations in low-resource settings, amongst many other topics. Through this conference, we are certain that the dream of universal access to quality healthcare will indeed be one step closer to becoming a reality.
We now request Revered Sadguru Sri Madhusudan Sai, founder Sri Sathya Sai University for Human Excellence, to address us. A visionary, he has established and spearheads institutions of public service in the verticals of health, nutrition, and education across 30 countries. Sadguru Sri Madhusudan Sai.
सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामयाः, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखमाप्नुयात्. Let everybody be happy. Let everybody be healthy. Let no one see any sorrow, no one suffer. Let all see only auspiciousness, goodness everywhere. This is the ancient Indian prayer. And that is the essence of Indian way of life, which percolates down to every aspect of Indian living, including medical services, education, and all other social initiatives. On this very auspicious occasion, I, on behalf of the university, the Chancellor, the Vice Chancellor, the Academic Council, and the Management Council, I welcome everyone to this conference, which has been so very painstakingly put together by Dr. Sunny Anand, and it is his initiative. So first and foremost, a big thank you to Dr. Anand. All the dignitaries who are on the dais, Dr. Gangadhar, Dr. Krishnan, Dr. Sachidananda, and all the other members of the university, and Dr. Raj Gopal, who has joined us from his institution. I convey our collective gratitude for making time to be a part of this conference. And as our Sri C. Srinivas defined it, let it be a path breaker in the field of the way healthcare is taught, learned, and provided, not just in our country, but in the whole world. The very prayer that we began with prays for everybody's well-being. Let all be happy, not just myself, not just my family, not just my friends, but let everybody be happy. And that's exactly what Soumya was telling. The access to health care, where it is needed, however it is needed, without any financial difficulties or hardships to the needy. That is the requirement, that is the need of the hour, that is the vision. And this conference is here to deliberate as to how do we achieve this vision. And one of the key components of achieving this vision of global access to healthcare by all definitely is the healthcare professionals. The video we saw just a while ago, it clearly said that the decision of a healthcare professional, be a doctor, nurse, paramedic, or anybody who is trained, largely lies in the financial burden that they undergo while getting trained. Baba would always say, మనం చదువుకుంటున్నాం కాదు చదువుకుంటున్నాము అని పిల్లలు చెప్తున్నారు. It means we are not studying, we are buying education. And that is the reason why we have to sell that education tomorrow to pay for the debt, the educational debt that we have taken on the way to getting trained. And that becomes a key factor in decision making by the trained students as well as their parents or their families in where the doctor should work, for what the doctor should work, for how long the doctor should work. All these get defined by largely the way healthcare is being taught to the students. And one of the large issues is the financial burden that comes along with medical education. I'm glad that all of us are here to discuss what can we do about it. As the university that we have here, we do not charge any fees to the students. We believe that education should be provided free of cost to all children who want to study. irrespective of their caste, gender, their religion, their socio-economic status. They all have right to education. And I firmly believe that every child has three fundamental rights: right to nutrition, right to education, and right to health. And this is every child's right, irrespective of which country the child is born. And to provide these rights to the children is the responsibility of every citizen of the world, not just of the parents, not just of the governments, but of the entire world, to provide these rights to the people. And therefore, while our constitution and most of the constitutions don't define health as a fundamental right yet, but I believe that it should be declared as one. And everything should be done to make it accessible, make it workable to all people of the world. Shri Raj Gopal, Dr. Raj Gopal, drew our attention towards a very, very important aspect of healthcare, which most of us do not like to discuss. As doctors, we would like to discuss life. Nobody would like to discuss death, which almost seems like a failure of healthcare system for not having kept the person alive. But he drew our attention to a very important aspect of healthcare, which is to bring dignity in death to people, to remove their pain and suffering. And that is the reason why healthcare teaching, education needs a different outlook. It's not just about cure, it's about care, because at some point in time, cure cannot happen, but care can happen. It's not about their capacities and caliber, it's about their compassion and character, which defines the doctor's ability to help the patient. And as he said, it's not just about the ability, but it's about the nobility of this profession, which we must keep up in our work. As an institution, we have set up several hospitals. And the most important feedback for us is when the patient says that we have been looked after very well, more than our own parents. And my patients are very, very young patients, ranging from 14, 15 days old babies to teenagers. And our Srinivas knows the biggest achievement for us is not that the surgery was performed technically perfectly. It has to be done, that's given, that should be done in a hospital which is set up. But more importantly, when the parents come and tell, we felt we were at home. We felt this is our family. We felt so much love, which we have never experienced anywhere else. That makes us very happy. We feel we are doing a good job at our hospitals. So the most important part of medical education should be to teach our doctors, nurses, paramedics to be better human beings with more compassion at the core, with care, health care. You see, the care part of the health care should also be taught in medical education, in schools of medicine. And our children should become more sensitive as human beings to pain and suffering of the people. It cannot be just a commodity, it cannot be a commercial transaction between a patient and a doctor. And I often joke that for most of the doctors, patients have become one patient registration numbers. So they just remember by bed number or patient number, but they don't even remember the name of the patient. So how do you feel connect with the patient? And that is the idea that we are humans basically, we are emotional creatures. First comes emotion, first comes our heart, then comes our head and hands, that is what the logo says. We as humans have hands, that is the physical body, the head, the mental well-being, and the heart, the emotional and spiritual well-being. So as now we have Dr. Krishna from WHO, and the whole world recognizes that health is just not the absence of sickness or disease or infirmity or injury. It is the holistic well-being of physical, mental, and social. But I would like to add the spiritual component to the healthcare, to being well. That part is missing, and I think Dr. Raj Gopal brought that point out, that how a person who is going to die sooner or later feels relieved when Bhagavad Gita is being chanted to that person, or whatever his spiritual beliefs are. When that is provided to that person, we may not be able to remove the pain, we may not be able to remove the disease, but we can definitely deal with suffering. The person may go through pain, but he won't suffer, because we have touched his heart. We have touched that emotional aspect of the person, which often goes unrecognized. And patients are looked at as sick bodies, which need treatment. But we are not just bodies, we are fathers, husbands, wives, children, brothers, sisters. And we all have that emotional part, and that is what he said, the connect has to be there. If we don't connect with our people, our patients, we are not being good doctors. And Vaidyo Narayana Hari, as the scripture says, is not without a reason. God is compassionate. That is the first criteria, first definition of God. He's all Karunamayudu, Dayamayudu we say. He's compassionate. So if you want to be called a doctor, you have to be compassionate. That is the first thing. And compassion you feel only when you feel oneness with each other. You feel they are also our own, Vasudhaiva Kutumbakam, all are ours. And that is the thing that I keep emphasizing upon in our university and everywhere in our healthcare system. Feel that the patient is your own family member. Don't feel he or her, she is somebody else. They are ours. They're not others. This idea of embracing everyone as ours should be at the core of providing especially healthcare, because when we are sick, we want our mother by our side. We want our father by our side, our friend by our side. And that is the time when in an ICU, the child cannot connect to mother or father. The healthcare provider becomes the father, becomes the mother. Even if you grow old and you fall sick, tell me, whom do you remember first? Whom do you want by your side? You want your mother, right? Or your father to put his hand or her hand on your head and make you feel comfortable. Doctor has to play that role for the patients. So a doctor's job is much more than just being a technically trained medical professional. He has to be more than just a human. He has to be God. And that is when healthcare will become effective. That is where our systems will become efficient. Patients, as I said, if we can't cure them, if we can't remove their pain, at least we'll remove their suffering through the care that we can give. So I would like to draw the attention of all the medical professionals to this idea of healthcare, that before making healthcare accessible to the patients, which is the idea of Sustainable Development Goals, which is the idea of WHO and various world bodies, let us work on making healthcare education accessible to people. And there lies the solution of making healthcare accessible to people. If you make education accessible, affordable, I'm sure healthcare will become accessible and affordable at some point in time. So the root, our cause is here in making the education accessible, and that is the effort we are being put. I would like to share these good tidings with our dignitaries here, who are people of great achievement in the field of medicine and global healthcare, that we as a university are all set to start a medical education wing, which would strive to provide medical education at all levels, from nursing, paramedical training, to graduate and postgraduate and super specialization programs, absolutely free of cost, especially to the rural and the poor. And for that, we need all your guidance, we need all your support, all your blessings, all your best wishes, so that this idea of making healthcare education accessible to people, leading to healthcare being accessible and affordable to people, can be realized in our lifetimes and not a century later. So we are all set to do that, and this conference is going to be a great way of understanding how we can achieve that. So once again, I would like to convey our gratitude to all those who have made it to the conference. And I would like to convey a special gratitude to Dr. Anand for having organized it, especially soon after the COVID pandemic. And we don't even know whether it's soon after yet. But he has taken efforts to travel all the way and make this conference happen. I wish you all the best, and I request all the children to please pay sincere attention to everything that is being spoken. Whether you are going to be future doctors or not, you can always become future patients, so better pay attention to all that is being said, and understand and ask questions where you feel it's appropriate. And I request all our dignitaries to answer the questions. They are young minds, but they are the future and ignited minds, as Dr. Abdul Kalam will put it. So they must understand the need of the hour, and they must know their responsibility in the coming times. So I wish you all the best for the conference, and I thank you all once again. Shanti, Shanti, Shanti.
Thank you, Revered Sadguru. It is truly about care and not about cure. I'd like to take a page from the Sanjeevani chapter, sharing my experience of how care impacts patients. At the Sri Sathya Sai Sanjeevani Centers for Child Heart Care, annually 5,000 children with heart conditions are healed. But it is not really a number. I have a small story to share. Recently, in the Khargar Hospital of Sanjeevani, we had a family who brought a neonate. It was a 2-day-old girl who was brought with a heart condition, a complex one, and the surgical team took up the case. In about 4 days' time, the mother, who actually underwent a C-section, joined the child in the hospital. The mother was going through postpartum depression by the time she came to our hospital. So while the child was operated and was curing well, the medical team was actually spending all their time with the mother to ensure that she feels well too. And you'll be very happy to know the doctor who treated the child, her name was Dr. Rashmi. This mother was so grateful to the love and compassion she received from the surgeon that this neonate was named Rashmi. That is the impact of compassion, the effect of compassion that the doctors have on patients, and this is just one story. So this sets the tone for the conference. We look forward to the panel discussions and all the experts sharing their thoughts and, more importantly, developing a way forward. With this, we conclude the inaugural session of the conference, and we meet at 9:15 for the first technical session. Thank you.